Welcome back from the Leeds Grenville and Lanark District Health Unit. I am talking with the Medical Officer of Health, Dr. Linna Li, and we're going to be talking about a survey that the public is going to be welcomed to actually fill out. But be honest when you're filling it out, okay? If you've had a problem or whatever, state it, because that's what they need for their strategic planning going forward. So, Dr. Li, welcome to the program.
Yeah, it's always such a pleasure to be here.
Thank you. We always love to have you. So there's a survey, planning of this strategic planning going on. Strategic planning is going on, so you're doing a survey. I'll get it out in just a minute.
Yeah, so that's exactly it. Organizations such as ours, we undergo strategic planning every 3 to 5 years.
Yes.
Our strategic plan did lapse during the pandemic, but of course, pandemic was no time to be doing stuff like that.
Exactly.
So now we're really looking at our strategic plan, and the idea is to consider who we are as an organization, what we do, and how we do it. So not necessarily the specific programs that we deliver, which is determined in large part by the province, but what does it look like for us? What does it look like to serve the population and our communities? And so that's the public and client survey that I want to talk about today. So it is a survey. You can go on our website, healthunit.org.
Yes.
And on the front page, there's a little tab you can click.
Yeah. Mm-hmm.
And then it'll take you to the little blurb about the survey and then the link. And then the idea is for members of the public, people who've received services from us as clients, or people who haven't received services but live, work, or play in Leeds, Grenville, and Lanark, all of those people to give us your feedback and thoughts about what it is that we do as an organization, as the health unit.
Yes.
What you would suggest, what might be important for us to look at or consider in the coming 3 to 5 years.
Okay.
And as we're doing that, what we're hoping is to get that feedback from the members of the public and clients, as well as from partner organizations that we work with, and of course a lot of our internal with our staff.
Yes, of
and
course.
our board and all of that, pull that together into a strategic plan, which we're hopeful the timeline will be fall and winter. These sorts of things, the timeline shifts a little bit depending on what else is happening in the organization.
Yes, nothing is cast in stone, right?
Yeah, absolutely.
So a consulting firm has been hired to handle this, correct?
Yeah. So the consulting firm we've found is People Minded Business. They will be doing the survey components. And so we've worked with them on the survey questions, but they will receive all the survey results. So the survey is anonymous and it's confidential. So they would receive the results, not us. And so, like you said earlier, please be honest. Please give us the feedback. That, the better, more substantial the information that we get, the better we're able to take those comments into account as we do the strategic planning.
Exactly. And that's what you do need. You think you're doing something right, but maybe there's a better way.
Yeah, absolutely, right?
So share it with us so that, we know.
Absolutely, yeah. We won't take it personally.
No, no. So just for our viewers, give me an idea of a type of question that you would ask.
Yeah, so there's a few types of questions. One is, how you feel about the services that you're receiving now, or what do you know about the health unit if you haven't received services directly.
Okay.
And then the other type of question is, what do you think will come as challenges or as important things to consider for both the health unit as well as for health of people in our region over the coming number of months, say 5 to 7, or sorry, not months, years, 5 to 7 years.
Yeah. Okay.
Yeah.
Okay.
And so really thinking not just about the existing health unit services, but also thinking about how we deliver those services, what works, what we could improve if you've received services from us directly, what you might consider a gap, things for us to consider.
Yes, yeah. the impact that it would have on the individual if they do use any of the services, right? Okay. I just so that our public understands, because you mentioned survey and all of a sudden people get uptight. Oh, is that right? I don't want to tell them how much I make or how old I am.
Oh, no, nothing specific. Yeah. So it is anonymous. We're not asking for identifiable information from individuals for the survey. I should say we will have opportunity for some focus groups as well down the road. So those would be virtual and held by our consultants, and more information to come. We don't have the dates and times yet, but those we would ask for your contact information just so we can find you to send you the information. But again, it wouldn't be to be able to find you afterwards to give you responses to your feedback. Really, it's so that you can give us the feedback, and hopefully those focus groups are a way to probe a little bit deeper from the information that we get from the surveys. So it wouldn't be, for example, the same person necessarily filling out a survey who would then go to a focus group. It might be different people, but just getting a pulse on people's thoughts, the feelings of the community.
Yeah, which is a good thing.
Yes, it's
important. You can't help them if you don't know what they need, right?
Yeah, that's exactly it. That's exactly it.
So, And if people need more information, is it best just to call the health unit or drop an email? And say I'm having problems or whatever? What do I do?
Yeah. Lots of ways to get in touch with us. So you can go on our website, healthunit.org, and we do have a contact us section.
Yes.
And that, for example, can be an email that you send to us. You can call us as well. I don't know the number off the top of my head.
That's okay.
Or we are on social media as well. So we're on Facebook, we're on Twitter, we're on Instagram. And so if people want to reach out to us through social media, they can do that as well.
And be respectful, please.
Yes, as always.
Yes, as always. All right. So we've talked about the survey. Is there anything else that you want the public to know about the survey?
I think that pretty much captures it. I'm really looking forward to it. I'm really, really looking forward to the strategic planning. It's important that we have a sense of the day-to-day work. Sometimes it's like this, right? Where the day-to-day work is the work, but then the greater sort of like the North Star that you're working towards, that gives life to the day-to-day work. And that's what I'm hoping the strategic plan will help us with.
Good. Mosquitoes.
Oh, yes.
Oh, my. I like going out to my flower garden, but those darn mosquitoes are after me all the time.
They really are.
Is it just because of our weather this year?
Yeah, so we've had quite a wet spring and summer, and I think there's been lots of conversation among people who farm, for example, people who have gardens. The crops have the timing has changed a little based on the weather compared to our usual, and one of the outcomes of that as well is, of course, mosquitoes, especially in a combination of wet and also hot. You end up with even more mosquitoes. We have a set of, so there's a number of species of mosquitoes sort of all around the world, and for us locally as well. There's different types, so some who bite in the dusk and dawn, some who bite all throughout the day, some who are littler, bigger, all of that. From a public health perspective, there's a few things to know. One is there are some diseases that are spread through mosquitoes. So I think people are familiar, for example, with West Nile disease. We've recently put out some news releases about a virus called Eastern equine encephalitis, which is also carried by mosquitoes. So we do know that there are mosquitoes that carry diseases in our region, and sometimes they can be severe, and so it is important. So that's the first thing, and then the second thing, of course, is it is important to protect yourself against mosquito bites. So there's a few things you can do. The first is prevention of mosquitoes as much as possible. So keeping track of the standing water in your house and turning over buckets or whatever the case may be with the standing water. Keeping your grass relatively short or at a manageable comfortable length to reduce the amount of mosquitoes as well. And then for yourself and your loved ones, using a bug spray that our recommendation is to use something with DEET in it because it is effective. And as well, wearing long coloring, especially light colored clothing, all of those can help.
Okay. Perfume is not a good thing though, is it?
Sorry?
Perfume is not a good thing. Anything sweet smell, that kinds of attracts them.
So there's mosquitoes. They have a really unique sense of, I don't know if you would call it smell. I'm not a mosquito biologist, so I don't know what the term is, but they're attracted to certain things, right? And that makes a difference. And of course, some people are more attractive to mosquitoes biologically than others.
Yes.
That is known, although I myself don't know why or how.
That's okay. That's fine. It's just, what I would like to do is to invite you to come back because I would like to talk about some other things like masking. There's the new Moderna that's coming out. And I'll talk to you about the flu. So would you mind coming back at another day and we'll have an interview and talk about these things?
Yeah, absolutely.
Okay,
I would be delighted.
Appreciate that. All righty.